Well, I mean, it's a rare disease. And so to focus on a treatment that's proven sometimes can be difficult. So for example, what's the best treatment of depression in Huntington's disease? There really hasn't been a study to show that SSRIs are better than tricyclics or another class of medicines. So I think when you're focused on treatments that are proven, it's easier to get, and shorter term, to get proof of principle in terms of motor aspects. So it's very obvious to see what happens to chorea over a few weeks. It's not so easy to see what happens to mood fluctuations or irritability or fatigue over a few weeks. That's a bit longer in terms of influencing that aspect of Huntington's disease. Yeah, I mean, Huntington's disease is a progressive process, so it gets worse over time, it fluctuates, it may change in response to people's environment, whether it's a life change, if they're stop driving or lose a job or move. So the usual life stressors can exacerbate symptoms, but over time it gets worse. And so every 6 to 12 months, certainly, you need to reassess the disease and the treatments. Usually more often than that if things are more active. The data that we presented today was about the safety of using deutetrabenazine over about a year's time. And in terms of dosing, to start off, there was a gradual increase of dosing over the year. And with that, we saw a gradual improvement of chorea over time as well. So I think it speaks to the fact that you do need to reassess chorea and other motor aspects of Huntington's disease over time, and you can continue to make adjustments. The other aspect that we were most concerned about was the emergence of neuropsychiatric side effects, which we really didn't see, and the development of Parkinsonism over time. And so people with Huntington's disease can have the development of slowness or rigidity or other signs of Parkinsonism, and that can happen in particular when the dopamine system is involved and suppressed, such as with a VMAT2 inhibitor, and we did not see an exacerbation of Parkinsonism. So I think that it supports the double-blind placebo-controlled data, and I think it shows that there's continued safety over at least a year's time in using this drug.